Trauma is one of the highest yield topics for your exams, and with the release of the ATLS 11th edition, there are critical updates you cannot miss. Today, we're doing a high-speed, revision-focused walkthrough of the current protocol. Focus up. This is the difference between a rank and a miss. The biggest shift in the 11th edition is the move from the classic ABCDE to XABCDE. The X stands for exsanguinating hemorrhage, catastrophic external bleeding. In trauma, we don't start with the airway if the patient is literally bleeding out. You stop the massive bleed first with a tourniquet or direct pressure, then you move to the primary survey. Remember, treat the greatest threat to life first. Airway is your first priority in the survey. Always maintain C-spine stabilization. That means no head tilt, only jaw thrust. If the patient has a GCS of less than 8, the rule is simple: you intubate. A common exam trap, the most common cause of airway obstruction in trauma, it's the tongue. For confirmation of tube placement, the 11th edition reinforces the use of waveform capnography as the gold standard. For breathing, keep an eye out for tension pneumothorax. This is a clinical diagnosis. Do not wait for an X-ray. If you see tracheal shift, absent breath sounds, and hypotension, you act. The 11th edition confirms the site for needle decompression in adults is the 5th intercostal space, anterior to the mid-axillary line. Second space is now mainly for pediatrics. Circulation is where the numbers matter. Focus on the shock classification. Class 1 and 2 are compensated. The blood pressure is usually normal. The real danger starts at Class 3, where you've lost 30 to 40% of blood volume. This is when the blood pressure finally drops. If you see a drop in systolic BP, the patient is at least in Class 3 shock until proven otherwise. Resuscitation has evolved. We've moved away from aggressive fluids. Start with a 1-liter bolus of warmed isotonic crystalloid. But if there's no response, move to blood and blood products early. The 11th edition stresses the 1-to-1-to-1 ratio of plasma, platelets, and packed cells, known as balanced resuscitation. And don't forget permissive hypotension, keeping the BP just high enough for perfusion without popping the clot. You've heard of the lethal triad, but the exams now want the lethal diamond. We have acidosis, coagulopathy, and hypothermia, but the fourth corner is hypocalcemia. Massive transfusions often lead to low calcium because of citrate toxicity. This diamond of death is a favorite for recent INICET questions, so memorize it. Keep the patient warm, give blood early, and watch that calcium. Next, disability and exposure. Assess GCS and check the pupils. Remember, GCS is now GCSP in some neuro protocols, accounting for pupil reactivity. For exposure, completely undress the patient to find hidden injuries, but immediately cover them with warm blankets. Hypothermia is the silent killer in trauma, and once it sets in, the coagulation cascade fails. Adjuncts like FAST and EFAST are essential. The E stands for extended. We look at the pleura to rule out pneumothorax. A positive FAST in an unstable patient means they go straight to the OR for a laparotomy. If they are stable, you go for a CT. This stability-driven decision tree is a perennial favorite for NEET PG questions. Let's hit some quick exam traps. Flail chest? The primary problem is the underlying lung contusion, not the ribs. Beck's triad? That's for cardiac tamponade, muffled heart sounds, JVP distension, and hypotension. And the definitive management for a tension pneumothorax, it's not the needle, it's the chest tube, also known as tube thoracostomy. The needle is just a bridge. Time for a rapid-fire recap. 1. XABCDE means stop major bleeding first. 2. GCS less than 8, you intubate. 3. Needle decompression in the 5th ICS. 4. Class 3 shock is when BP falls. 5. The lethal diamond includes hypocalcemia. And 6. Positive FAST in an unstable patient means immediate surgery. Master these and you're ready for any trauma question they throw at you. That's the ATLS 11th edition protocol in a nutshell. Trauma is about speed, precision, and order. Stick to the ABCs, or rather, the XABCs, and you'll save lives in the ER and score points in the exam. Good luck with your revision.